What are you seeing in your hospital system on the ground right now as you do roll out vaccines?
Well, in the Midwest, we actually had some of our peak COVID cases before Thanksgiving. And so we've actually had a downturn in cases in the last month or so. And depending on what state you're looking at, it's anywhere down 20 to 60%. And we probably had that peak in early November because for the longest time, the Midwest had been spared some of the true pain the rest of the country felt. People had relaxed their precautions, and so then there was a spread of virus. So now people are being more cautious, and so we're seeing hospital capacity able to deal with both the routine cases and the COVID patients.
It's interesting to hear. Oh, go ahead.
Go ahead.
Go ahead.
At the same time, we are ramping up to deliver vaccine to our employees and to the population at large.
Yeah, it's interesting to hear you say peak in November, because there has been commentary out there. I think Dr. Fauci said something just in the last couple of days as well about the fact that maybe the worst has yet to be seen so far. A lot of concern that with everybody traveling for the holidays, we could see the numbers continue to surge. Are you concerned about that in Nebraska, or do you really feel like it's peak because of things like masks and people doing more sheltering in after Thanksgiving?
As you just alluded to, peaks are entirely related to human behavior. If people do wear face coverings, if they avoid shared air with non-members of their family, there will be a decrease in the number of cases. So really, we cannot lower our guard for many months to come until there is wider spread immunity. So I agree with Dr. Fauci that there could be serious consequences in the coming months because of the number of cases that are out there nationwide.
Dr. Linder, I'd like to get your update on the vaccine rollout. Moncef Slaoui, the man who ran Operation Warp Speed, had talked about the possibility of inoculating as many as 20 million people by the end of the year. That seems highly unlikely given we're about 2 million in. But what are you seeing on the ground at your hospital systems right now in terms of how many people you're able to inoculate and when you'll get into the broader population?
Very good question. We actually began planning on inoculating our employees in October. It's a complex process because you have to have pharmacists to dilute the vaccine, nurses to administer it, and a data tracking mechanism. So we prioritize the 18,000 employees and students between Nebraska Medicine and University of Nebraska Medical Center to first address the frontline workers. And about 15% of those individuals have been vaccinated by the end of this week. And we look forward to getting more vaccine so that we can continue that. Probably the supply chain has been the most challenging thing for us, not knowing when we will get vaccine.
And what about a state like Nebraska overall, a rural state? Is it more difficult in some way to get to certain pockets as you roll it out more broadly?
It's clearly more difficult, but I have to give immense credit to the individuals who run the critical access hospitals in Nebraska and the state health department. They've worked diligently to make sure that the vaccine would be delivered to those citizens. And particularly with the availability of vaccines that require less cold conditions, that should be handled in the early part of 2021.
Dr. Linder, in terms of the vaccines that have been administered so far, what have you seen in terms of side effects in your employees and those that have received? Have people been calling out the next day, for example?
We've had very few side effects, and I think that they would be no more than many vaccines people receive. I think the major side effect we've seen is joy. People are genuinely happy to be vaccinated because they've been on the front line battling this virus for 10 months, and they see this as a way to protect themselves and their family. So they are very happy. They'll bear a sore arm for that.
Shepard Smith here. Thanks for watching CNBC on YouTube.